Dr. Riaz Agha here at Harley Clinic on Harley Street. I want to talk to women about how to do their breast self-exam. This is come into huge focus in recent times with younger people, unfortunately, being diagnosed with breast cancer. It's really important that women do their breast self-exams. Now, unfortunately, I don't have a model here, but I would like to demonstrate that you should start on the inside and work your way down with two hands like this. And then work back up with two hands and keep going across gradually by 1 centimetre each time and having a feel all the way down. And you just gradually work all the way around, including behind and under the nipple, all the way back here until you get to the armpit, and then with one hand have a look, feel inside the armpit, and then you should repeat that for the other side. This can be done in the shower. It should be comprehensive. You don't want to move too far along, otherwise a lump could move either side of you and you could miss it. And if you do find a lump, go and see your GP. It's really important that you do it, and I do encourage all my ladies to do it. Whenever somebody comes to me for a breast procedure, I do a breast exam on them.